Obviously, this is an important topic. There's many of you that wanted to come and learn about this and understand. Both our dogs and our cats, as well as if there's any exotics owners out there. We know that these, little lumps and bumps sometimes are not a big deal and sometimes can become a very big deal. So my goal for tonight is to try to talk a little bit about cancer in general, how cancer behaves, and kind of the spectrum of disease, so that we can understand a little bit behind how we're making these decisions and what's going on, as well as to talk about some of the most common masses, both the benign ones that are local growths that maybe we can watch, but maybe we can take out, as well as the actual malignant cancers that have that ability to grow and spread and really be something that can cause our pets a problem. So we're going to go over some of the most common ones, probably some that you and your pets or your family members' pets have had in the past, to try and understand a little bit more about what's going on there and the things to look for. And then we're going to talk a little bit about, okay, we found a lump or a bump. Now, what do we do about it? What are the next steps? How do I know if we should be worried? If we are worried, what are those next steps that we're going to take to try and make sure it doesn't become something that limits our pet's life? So we're going to start out a little bit with just, cancer 101. What is cancer? And the bottom line, the easiest definition of cancer is these are cells in our body that no longer pay attention to the signals that they're supposed to, and they just keep replicating themselves. Our pretty much all the cells of our body have the ability to divide and make more of themselves because our body needs to be able to repair itself. When we injure ourselves, when the cells get old, they need to be replaced by something. So most cells have this ability to make more of themselves. But cancer then is ignoring all of the normal rules that control that process. And it's just this uncontrolled growth of cells. And that's how we get a tumor. So if we think about the cell, we're going to go back to biology a little bit here. So we've got an individual cell with all of its little machinery and factories and workings inside of it. And the kind of the brain center, the guy telling everybody what to do, is the nucleus. Because the nucleus is what is housing all of our little chromosomes, which a chromosome is essentially our coiled up DNA. And the DNA is the cookbook. The DNA is what holds the instructions, holds the recipe for then the cell doing its job. And so the DNA, we start out up here with our DNA. And again, this is our cookbook, to be able to tell the cell what to do. That then gets translated a few different times until at the end of that process, we get the proteins. And that's what, these cells are here to do. For one reason or other, they have a job where they have to create proteins to allow us to live and survive and thrive, be that to help us absorb nutrients or to help excrete toxins. Any of our day-to-day living, it's all based off of these proteins. So having this recipe book so that we can make proteins appropriately is very, very important for our cells to be able to function normally and our bodies to be able to thrive. So the other main job of a cell, like we talked about, is the cell has to be able to make more of itself. Any given cell in our body can only survive for so long before it starts running out of machinery, before it needs to replace itself. Like I mentioned, there also is constant, repair that has to happen to our body. Get little nicks and cuts in our skin. We eat something we shouldn't have and our intestine gets upset. All of these things are triggering our body to repair itself and to make more new cells. And so that's a very complicated process where we have one cell that then has to duplicate the DNA that's inside of it, because it's eventually going to go around this circle and end up with two cells. So it means we have to go from one set of DNA to two sets of DNA so that both those cells can do what they're supposed to do. So making sure that this process happens appropriately so that there are two copies of the DNA that have the correct recipes, that there was no translation errors, there was no, oh, we forgot to add the salts type of issues. So there's several points in this cycle where there's check marks, checkpoints, where the body makes sure that things are happening the way they're supposed to, and if they're not, then the cycle gets stopped. And that the body recognizes, no, the DNA's been damaged. We need to stop this process. We need to tell these cells to basically commit suicide, so that they don't propagate DNA that is incorrect. The other problem is that not only can DNA be damaged when it's trying to duplicate and replicate itself to make more new cells, it can also be damaged in just our day-to-day living. So ionizing radiation, this is things like X-rays, smoking. We know there's carcinogens in smoke, UV light, air pollution. There's all these things that we know can damage the DNA and cause problems with how those recipes get made and how things are translated. And so ideally what happens is there's systems in place to be able to deal with these mutations when they happen. And so we have our normal cell, it gets a mutation, and there are mechanisms within the cell to be able to repair that DNA and get back to a normal cell so that it can, again, keep multiplying itself and doing its jobs and nothing goes awry. And if that process doesn't happen, then we have this thing called apoptosis, or cell suicide, where the cell is supposed to be able to recognize that this is not what it's supposed to be doing, that something went wrong, and it's actually going to go ahead and commit suicide so that it doesn't cause further problems. But then there's some that occasionally will get through. These fail safes, these mechanisms end up not catching every single last mutation. And so that's when we get into a situation where we actually are generating cancers, where we have this uncontrolled proliferation of cells that can either turn into a benign tumor that just keeps growing where it's at, or it can become an actual malignancy that knows how to invade into other tissues and be a truly aggressive cancer. So when we think about cancer that way, cancer is truly written into our DNA, which is why it's so difficult to treat. It's also why there's so many different types. You can see all the different fail safes that are in place to try and prevent cancer from forming. And so these mutations, it's usually not just one single thing that has to become a mutation to actually develop cancer. Usually it's multiple different mutations that occur over time. And which is why as we get older, our risk for cancer goes up. We've had more of those exposures to UV light, to smoke, to X-rays that can eventually accumulate into those damaging mutations that can cause cancer. Of course, there's also genetic components to this. So some of these, when we're born or when our pets are born, they can already have damage to some of these sequences in their DNA. And so it's accumulating just the right number or location of those mutations that ends up then developing into cancer. So if we want to talk a little bit more specific definition of cancer, it is all these things that have to be developed by the cells to be able to not only ignore those normal mechanisms of stopping and fail safes, but also to start to basically feed themselves. So they need to have their own growth signals. They need to make their own blood vessels, which is what angiogenesis is. All these things that has to happen. So while on the one hand, it's as easy as you need DNA mutations, it's also as complicated as having mutations in just the right locations that allows it to subvert all the normal mechanisms that are preventing cancer from forming. And again, then we come back to this tissue invasion and metastasis portion of things. And this is really the part that makes cancer fatal for us. Because if we just had a tumor of cells that were just growing and expanding and pushing things out of the way, then yes, we would have to do surgery to remove it or stop it from pressing on things that it shouldn't be pressing on. But that probably would be a fairly doable thing in most cases. The real problem with cancer is when it learns how to invade into our tissues, how to spread throughout our body, and truly then cause more tumors in other locations that are then going to cause us to actually truly have that that cancer-like occurrence where organs are failing, and this becomes a fatal disease. So this is kind of just another demonstration of what I'm trying to explain, and that is that there's the kind of this gradation. There's a scale. It's not that all of a sudden one cell turns into cancer and that's the end of the process, and that's everything that happens. Usually it starts out that there's a smaller thing, it's just single cell that has a mutation. And then there starts to be a few more lumps and bumps and having those mutations. And then they start to accumulate more mutations. And so the cells get more and more abnormal. But at this point, they're still just an accumulation of cells. They haven't learned how to grow and spread and be invasive yet. But then we get into the point where they've accumulated enough mutations that they're actually a true cancer, where they're invading at least locally. And then a true malignancy is when they've learned so much about how to evade the normal systems that they actually can grow and spread through the blood vessels, through the lymphatics to the other organs, and become a life-limiting disease. So we talk about cancer a lot as this, broad thing that kind of is a snowfield. It's just all the same, and cancer's a horrible thing, which is very true. But when we look a little bit closer, cancer is more like snowflakes, where each individual cancer, each individual tumor is a little bit different. They all have their each individual characteristics, and so each one is going to behave a little bit differently. Both in a generality of what tissues that they're coming from, as well as for our individual pets, how that's going to behave. So taking that information and that kind of understanding of what cancer can look like and how sometimes it's an aggressive cancer, but sometimes it's a benign tumor. This is how we kind of split out our different types of lumps and bumps to be able to know how many of them are problematic and how problematic they're going to be, which is these malignant guys over here, versus a benign tumor, where yes, it's something that shouldn't be there, but it's probably not going to be something that's going to be problematic. It's probably not going to be something that's going to spread and cause organ failure. It's going to be something where monitoring might be acceptable, or if it is something that is bothersome, then it can be removed. But hopefully it's going to be much less life-threatening, much less aggressive in its behavior. And that kind of, this idea of that continuum, you can even see in this first little line up here. We talk about melanoma all the time, and it's a very common skin cancer in humans. It's just as common in our dogs and cats, but again, there's different forms of it. Melanoma itself is just a cancer of the pigment cells of our skin, so the cells that make melanin. But usually in dogs and cats, when they're on the skin, they're going to behave in a more benign way. But they can be in this category where they're actually a malignant melanoma. So talking a little bit more about that. So this is a fairly typical appearance for a benign skin melanoma or a melanocytoma. So this is a Rottweiler. So he's got, dark pigmented skin underneath this fur, and most of him in general is fairly dark in color. And so 90% of the time, these are going to be benign. And if you look at this particular one, it looks a lot like a mole that you or I would have. It's smooth around the edges. It's a single color. It's a single texture and appearance. It's not red. It's not ulcerated. It doesn't look angry is the easiest way I can say that. And so this was a benign tumor, just a melanocytoma, that we happened to remove when this patient was under anesthesia for a completely different thing. But he didn't want to be Cindy Crawford anymore, and so we went ahead and removed it. That in comparison or in contrast to a tumor like this, which you can see that this area down here is pigmented, and so it's rising from the pigmented area within the mouth. But what we know about melanomas when they occur in the mouth is that they behave much, much more aggressively. And you can even see that in this particular tumor itself, because the tumor is actually no longer pigmented. So that means that these cells are so abnormal and they have changed so much that they're actually not even doing their normal job. They're not even making the pigment that they would normally be programmed to make. So this is going to be a very aggressive tumor that's going to want to come back and spread and be very problematic for this patient. So obviously we have to treat this and address this in a completely different way. And so location does matter for these types of tumors. And in general, things that occur in the mouth, of course we can have just excessive gingiva and things like that, the same as you or I can. But when we're talking about tumors that occur in the mouth, generally they are going to be more significant, more scary, and behave in a more aggressive way. So I think that's just a way for me to try and say that, when you find a lump or a bump that's on the skin, then there's a different set of rules, rather than if you find a lump or bump in the mouth. When it's in the mouth, we're pretty much always going to be worried and always going to want to figure out exactly what's going on with that. If we go back to the skin a little bit, we also have to remember it's not always a tumor. So in this particular case, this is actually a nipple, right? So it would look like it would be scary. It's pigmented, it's raised, little bump, and it seems like, okay, that's something that we need to get this checked out. We need to take to the vet so they can look at this. But we do also have to remember that these can be normal structures. So our dogs and cats have either 4 or 5 different sets of nipples, extending all the way from their chest down into their groin area. So it always makes me a little bit happy when I get to tell an owner, actually, it's fine. It's not a tumor. It's just a nipple. And in this case, that's the best possible outcome in that scenario. If we want to talk about other kind of more benign acting tumors, some of the most common ones that we see are basically skin tags. So we talked just a minute ago about moles and things of that nature. Along with that, we get these things we term kind of lumped together into skin tags or warts. These are generally benign. 90 to 95% of the time, these are benign. They're coming from the actual hair follicles themselves, or the sebaceous glands, which are the glands that make kind of the oils of our skin. Those glands are constantly working. They're constantly turning over. And so they can turn into cysts. They can kind of become pedunculated like this, where they're kind of long and dangly. And they can be, usually they're okay. Usually they're not problematic, but they can become irritating to the point where our pets want to scratch and chew at them, where they become red and angry, and sometimes even infected or ulcerated. So, sometimes we don't need to worry about these skin cysts or skin tags, and we can say, okay, we'll just monitor those. They're going to be fine. But of course, we're going to monitor them, and definitely if they are in a situation where they're becoming problematic for the patient, then we're going to want to do something about it. It's not even if it is a benign tumor, it's not really okay for them to have to go on antibiotics every few months because this thing just keeps rupturing and becoming infected. That's not good for them. That's not good for us. So, there are still reasons to take off these benign tumors, even if they're not something that's going to be scary and aggressive and cancerous. Along that same line of these being, benign tumors, there's these tumors that occur usually in young dogs, so less than 3 years of age. And these will actually, this one is particularly bad because it's right on his foot like this. And so every time he walks, he's going to walk on this. And you can see there's even this little red area in the middle. That's where the skin is actually broken open because he's been walking on this mass. And so this is a situation where, again, it's a benign tumor. We wouldn't normally have to address it, but because it's in this problematic location for him, maybe we would address it. Maybe we would do something more about it. But in general, these are the ones that look kind of like warts that are all over the place. And they are more common in the young dogs. We think it's actually that they can be virally induced, and in a younger animal, their immune system hasn't quite figured out how to fight it off yet. But then as they get older, their immune system changes a little bit, and they can actually then get these little tumors to go away. So, we never talk about, or very rarely do we talk about miracles, but sometimes our body does a pretty good job at figuring out how to get things to go away and to be more appropriate. So again, this is where knowing what we're dealing with and knowing what type of tumor we're dealing with is going to be very important, because it's going to guide our decisions. One more kind of lump or bump that I'm sure that everybody's had a lot of experience with, especially if you have like Labradors or things of that nature, is this idea, this thing called a lipoma. And basically what a lipoma is again, it's a benign tumor. It's usually not a problem, and it's an accumulation of fat. So when we do surgery for these and remove these, it really does end up looking like a ball of fat, a little egg of fat when we remove it. And even when you feel it, if it's under the skin and it feels very jelly-like, like you're touching fat, it's squishy like that. And so those types of textures can sometimes be indications for us, both from the aspect of, is it something that's a little bit less scary? But also from the standpoint of, if the texture of something suddenly changes, then we know we should be a little bit more worried. So I've definitely had patients and had cases where the patient had a lipoma and had this fatty accumulation. We did the testing to prove that it was just a fatty accumulation. And sure, it was slowly growing over time. That's not something we really, we all have fat at various places in our body. It's not something that we worry about too much, as long as it's not in a location where it's causing them a problem. When it's in their underarm, when it's in their groin, it's going to cause them problems being able to move around, then of course we want to remove it. But most of the time, a lot of the time, we can just continue to monitor these, especially because patients tend to form multiples of these. It's not usually just one little one. It's usually that they kind of have them all over their body. And so rather than turn them into something that looks like Frankenstein, we can monitor them and just make sure that they're not changing. But like I said, sometimes the texture will change, and that can be an indication to us that there's something that's progressed. There's something that's evolved, and maybe we need to go back and do more testing, or maybe that is something that we should go ahead and remove. So for example, I've had a patient recently that had a mass that had been there for years. It had been tested to be a lipoma, but it recently changed its texture. All of a sudden, it got more firm and hard. And we tested it again, and it actually was now a mast cell tumor, which is the next tumor that we're going to talk about. And whether it was actually, probably it wasn't that the lipoma randomly changed into a different tumor. Probably it was just that another tumor happened to occur in the same location. And so they were kind of one on top of each other and colliding a little bit. But mast cell tumors are another one of those tumors. And this is now when we're getting a little more into the cancer side of things. These tumors can be more scary. And they are actually the most common skin tumor in dogs, and actually they're fairly common in cats as well. The good news is in cats, they're almost always fairly benign in behavior when they occur on the skin. They're more lethal when they occur in the internal organs in cats, which is again also true for dogs, except for the fact that in dogs, 80% of the time, these tumors when they're on the skin, they're not going to spread to other locations. They're going to have a very low rate of spread. And so being able to remove them with surgery is going to be the most important part of being able to treat these patients and get them to be feeling better. We do know that there's somehow a immune or allergic type of component to this, because mast cells are part of our immune system. And it does seem that certain breeds are going to be more predisposed to getting these types of tumors. So this is our boxers, our Bostons, our Labradors and our Goldens, who tend to get these tumors a little bit more frequently. And if you look at these, we actually call mast cell tumors the great pretenders, because they can literally look at like anything that they want. And anywhere from just a little bit of skin that doesn't have hair anymore, there's kind of a plaque there, to something that looks a little bit more angry like this, where it's multiple lumps and bumps in an area that are kind of red and irritated and swollen. Or this particular tumor that's actually taken over the foot and is destroyed this toe. So they can look like almost anything, and they can look like a more aggressive and more assertive type of tumor. The other thing that we know is once a patient gets one of these mast cell tumors, they're going to be likely to get more in the future. So unlike some of the other cancers that we've been talking about, where just getting a single tumor doesn't mean that you're likely to get it again, in this particular case, it does appear that once your body has learned how to get this tumor once, then it's common for it to learn how to do it again. And it doesn't necessarily mean that the original tumor has spread. It usually means that there's actually a true new tumor that's formed that is unrelated. So the reason that we kind of call these the great pretenders, and they can look like whatever they want, is because of the cells that they come from. And so this is what a mast cell looks like underneath a microscope. And so these are the white blood cells. This kind of purple part in the middle is the nucleus. And then you can see that these ones kind of have these purple dots all throughout the inside part of the cell. And these are all granules that contain histamine. So the mast cell's job in the immune system normally is to control allergic reactions. And so if it gets triggered, if these mast cells get triggered, then they release this histamine, release all the other factors that are in these granules, and cause the local swelling, the irritation, the itchiness that happens anytime we get a bug bite or some type of allergy like that. But because of that, in these tumors can also, they can shrink and grow and shrink again, because the swelling is actually from the histamine and from the actual fluid around the tumor, not the fact that the tumor itself is changing sizes that rapidly. They're also more likely to look kind of like this, where they're more irritated and bleeding, because, and these are the ones when they get this histamine release, why they can sometimes look like that. But then a few days later, they can go back to being a fairly normal, not raised and irritated mass. So these guys have a very wide range of what they can do, as well as how they might look. The good thing is that we have some really good techniques to be able to test them and to diagnose them so that we know what we're dealing with and know if we need to remove them or not. One of the other types of cancers that we deal with on a fairly regular basis is squamous cell carcinoma. So this is a cancer of the actual, so squamous cells are one of the layers of the skin. And so if we're talking about light induced tumors, this is the other tumor that gets induced by UV light. And so usually it happens, you can kind of tell in this picture that this pit bull doesn't have a lot of hair along the margin of the eyes, along the lips and the around the nose here. So that's an area where there's not pigment and there's not a lot of hair to be able to kind of protect those areas from the sun. And so that's the most common place for them to get these types of tumors. And so kind of, again, right along the margins of the eyes where UV light, sunlight can actually get down to the skin. And this is a fairly good image, you know, it is fairly early on where this essentially just looks like some scabs along the edges of the eyelid like this. It's also very common to happen on the nose and the ears. And so this is very early in the process where we still have a lot of options about how we could potentially fix this and remove this cancer. Whereas if we get to this point, this is what happens if it's allowed to go for a long period of time. So this was actually a stray cat that, you know, obviously was not getting veterinary care. And so when he was brought in, you know, this was the tumor that actually ate away at the top of his ear right here. And was eating away at this skin. So this is a type of cancer that's often ulcerated, often red and bloody, and can easily get infected. And just keeps eating away at those local tissues. Takes a longer time for it to spread to other areas of the body, but these are the kind of things that we're looking for to make it scary for us, to make it more worrisome. You know, if we see this, we know that there's something that we need to address. And I apologize. I know it's kind of, we're getting to the dinner hour, so I apologize for anybody that appetite is now lost. This next picture probably won't help either, but this is also another squamous cell carcinoma that you can see there's not only new tissue that's being formed, but it's also eaten away at the normal tissue that was there. And so again, we have to be more aggressive with how we treat these because the tumor itself is more aggressive in the way it behaves. If we back away from the super aggressive and ulcerative ones, the ones that look a little bit prettier, but just like to make our pets into unicorns and things of that nature, we can talk about fibrosarcomas or fibromas. So again, we're in this situation where fibromas is a benign tumor where it hasn't learned how to invade and spread and behave in a truly aggressive way, versus a fibrosarcoma has now become that true cancerous thing that's going to be worrisome and scary for us. And these are often, you know, if there's like a little, you know, BB feeling kind of thing underneath the skin, something of that nature. A lot of times this is those types of things and how they feel. Obviously, this is a more extreme situation where, you know, this has been growing for quite a while. Again, this was a rescue animal. So, you know, was for a time not getting the veterinary care that we could have provided if this was smaller. But this arises from those connective tissues. So the scar tissue, the muscles, those, you know, tendons, those types of things that can then grow into these tumors. And the skin is one of those connective tissues. Kind of the bottom part of our skin is this collagen matrix that holds everything together. And so these tumors can still form. And again, usually they start out as a little BB, but they can become more aggressive like this. And a lot of times the problem again here is not that they want to spread to other organs and do those things. It's that they outgrow their local blood supply. So this is kind of shaved areas where the tumor is. This black area in the middle here, that's actually a scab that's formed on top of the tumor, because the skin there died. Part of this tumor did not, it outgrew the blood supply that it had, and it made the skin not have enough blood supply. And so it actually became an open wound that became infected, became a scab. And so, we have to now address this because we don't want it to be a source of infection, in addition to the fact that we want to get the tumor itself, the cancer, removed. These are also fairly common, one of the more common tumors that occurs in cats. And this cat's expression fairly accurately portrays how they feel about this, because they unfortunately tend to be more aggressive in cats. These are the ones that were initially linked to vaccines. And now we've kind of realized that it's not just vaccines, it can actually be any type of injection or irritation that then starts this process of these cells developing into cancer. And in this particular type of cancer, they can be very invasive. They've got these fingers and tendrils that grow out into the surrounding tissues. And so these end up being very large surgeries, even for a very small tumor, because of these little tentacles that it's formed in trying to remove every last tumor cell itself. So we don't like these, and cats don't like these either. And it's why now a lot of your veterinarians, if you've seen them, they will actually give injections either very far down on the leg, like below the knee, or out on the tail. So if these tumors do form, we at least have an option of amputation and controlling that tumor more effectively, rather than something between the scalpel blades where we're talking about removing some very significant structures to even attempt to get control of them. So very important thing in terms of watching for lumps and bumps in our kitties as well. So now that we're nice and scared about all of the types of cancers, and that's just a handful of the different ones, but the more common ones that can occur in our pets, in our dogs and cats, the question is, well, what do we do about it? How do we address this? How do we keep this from being something that limits their life and causes them significant problems? And similar to what you've heard probably from your own doctors and on public service announcements, really the most important part is early detection. It's finding these when they're small, before they've spread, when we still have a lot of tissue to work with, a lot of good options for surgery. The bigger these get, the fewer options that we have, and the more likely it is that they've already spread to other areas of the body. So if you find a lump or bump, that doesn't automatically mean it's a tumor. It doesn't automatically mean that it's cancer. There's, just like you and I, we get bit by, little bug bites. We get little splinters that cause little bumps, moles, warts. There are normal lumps and bumps that we can just continue to monitor. So what are we looking for to say, nope, this one is scary, we need to do something about it? And this ABCDE is probably something you've seen in a lot of your dermatologists or primary care doctors' offices, because this is the recommended scale for monitoring moles and melanomas in humans. And those same principles apply to our dogs and cats. So what we're looking for is an irregular shape. That very first mole that I showed you is very circular, very smooth around the edges. There was no irregularities, there was no asymmetries. It was, nice crisp border. It was all one color. There was not part of it that was lighter color or darker in color than another part. And probably the most important part is how is it changed in size? If it's staying the same size for weeks and months on end, then probably it's not going to be something that's going to behave too aggressively. Probably that's going to be something that's going to be fairly benign in nature, and we can continue to monitor. But if it is growing, if it is changing in its texture, if it's changing in its color, if it's growing to the point where it actually is getting red and irritated and ulcerated, those are definitely signs that we want to further investigate things and maybe even remove it, even if we don't think it's that scary. So how do we figure it out once we look at this and say, okay, there is a bump here. It does seem to be growing, or it's a brand new bump that we want to investigate. We want to know what's going on with it. How do we get that information? How do we try to give it a name and put it in one of these categories so we can try and predict how it's going to behave? And one of the first ways that we do that is what's called a fine needle aspiration. So that uses just a normal standard vaccine needle. Then it pokes into the tumor through the skin to get a sample of those cells out. And this is what the cells look like underneath the microscope. And we can look and see what types of cells are there. You know, are these characteristics of one of these certain types of cancers, or is it that we can't really tell? That happens. The nice thing is that these are about 80% diagnostic. So usually we can tell with just a poke of a needle, is this a mast cell tumor or is this a cyst? Those types of differentiations that are going to be very important in terms of how we are going to decide to treat this. Are we going to monitor this, or should we go ahead and remove it just so that we know that what we're doing is right? Or no, we actually have a cancer diagnosis. We absolutely need to get this removed and make sure that it doesn't spread. So for skin tumors or skin bumps in general, that is about 80% accurate. If that's not enough to give us an answer for one reason or the other, then usually our next step is to actually do a biopsy. So rather than getting individual cells like what you saw on the last slide, this is actually a piece of tissue. And the main thing there is that it actually lets us see how those cells are interacting with each other. Are they respecting each other and playing nice and staying in their lane, so to speak? Or is it that they're actually invading and being mean to their neighbors and going past the borders that they're supposed to? So in this particular tissue sample, this right here is an actual melanoma, and you can see it's pushing these guys out of the way. It's moving things out of the way, so it's not being nice to its neighbors, and that is something that we're going to want to remove. There's different types of biopsies. Sometimes we just take a piece, either with what's called a core biopsy or a punch biopsy, or an incisional biopsy. There's different names depending on how we take it. But sometimes it's just a piece. Sometimes it's actually removing the entire tumor at the time of surgery. So in what we would call an excisional biopsy. And sometimes we'll do that especially if we don't have many other choices. If a tumor has gotten very, very large, and we don't have enough tissue to work with, or it's in a location where we don't have a lot of tissue to work with, we might choose to remove the entire tumor as our first step, and then know that we might be leaving some cancer cells behind because all we did was a biopsy. But one of those two things is generally done to give us an answer about the name of what this tumor is. Is it scary or is it not scary? If it is something that's actually a malignancy, either when we find that out, or sometimes even beforehand, if we're very, very suspicious that it is actually a cancerous process, then we'll do what we call staging tests. And a stage of a tumor is looking to see how far it's spread, or if it has spread to other areas of the body. So the stage is there just a single tumor, or is there potential tumors that are growing in the lungs? Or are there potential tumors that are growing in the abdomen? So this is a sonogram of a kidney. So similar technology to look at a fetus inside a pregnant mom, but using those sound waves to actually look at the internal organs to see if there's any evidence of tumor cells that are growing there. We also will try to look at the lymph nodes that drain the lymphatic fluid from a particular area. So tumors and cancer can spread through the blood, but they can also spread through the lymph fluid, which is kind of the fluid that gets pushed out of a blood vessel as the blood flows through the body. That fluid, that lymph, then has to return back into the bloodstream through these lymphatic vessels. And this is one of the ways that cancer can spread as well. So that's usually the typical testing methods that we use to know exactly what's going on and if our tumor has spread. Sometimes we will do a CAT scan to actually let us understand in a higher detail. So that gives us more of that three-dimensional view. It's a higher sensitivity than an X-ray and an ultrasound. The downside to it is, of course, it's a little bit more expensive, and it does require general anesthesia. So for you or I, they tell us to sit still for the 10 to 15 minutes that the scan is being performed. But in our dogs or cats, they don't quite understand that they need to stay still for that long. And so they do actually have to be under anesthesia for that process. But that's one of the ways that we get the most information, along with, things like MRI or PET scans. But usually it's going to be a CT scan, similar to what is done in humans. So once we know the extent of where our tumor is, then we get to go. Usually surgery is going to be our first line of defense in terms of removing these masses, removing these tumors, if we decide that they do need to be removed. There's, of course, a whole team effort that goes into this, but a lot of times removing as much of the cancer as possible, if that is in an area where it's feasible, is going to be our first step once we've come to a point of diagnosing that this needs to be removed. And when the thing that we think about when we remove a tumor is, like we were talking about earlier with the cats, it's not just the tumor that we can see with our eyes. The tumor has these little tendrils that are growing out. And so it's not just enough to remove this part that we see with our eyes. We need to make sure that we get those tendrils too, to actually make sure that all of the local disease is removed and that this isn't just going to grow back in a few months. Even benign tumors can grow back locally if we don't get everything removed. So rather than going at this first line where we're still leaving behind those little tentacles, we're actually going to move out and try and get all of that removed in what's called a wide resection. And that means that we're going to take usually 1 to 2 inches of tissue beyond the tumor that we can see with our eyes and feel with our fingers to make sure that we're getting those little tentacles. And that's one of the thing that's so valuable about having a name for a tumor before doing this surgery, is that we know, if this is a benign tumor, we can take just a little bit, maybe only a half an inch of that tissue and make a smaller scar and have it be less painful. But if this is truly something that's a scary cancer, then we need to make sure that we get all of that tissue and get all of those individual cells. And so it's worth making that bigger incision. As I mentioned, this is absolutely, oncology is a team sport. So we have our local treatments, which include surgery. And if surgery is either not able to be performed or only able to remove part of the cancer and not remove all of the tumor cells that might be left behind, then we use radiation to try and kill any cells that are left behind locally. And then if it is a true cancer where we're worried about it spreading to other organs, spreading to other areas of the body, then that's when we start to use chemotherapy or immunotherapy, vaccines and things of that nature, to try to kill any of those individual cells that have spread to other areas of the body. So while surgery is definitely a part of this, treatment paradigm, it's definitely not the only thing, and it might not be the only stop along the road if this does turn out to be something more scary. So thankfully, not all of these tumors are scary. And so I want to go back to that. What do I do when I find a lump or bump? And the biggest thing that I can ask you to do, and the most important thing you can do for your vets, if and when you were ever to find these and get these checked out, is to keep track of it. So remember when you find it, remember how it feels, even measure it if you can, even, comparing it to the size of one of your fingernails or an object of food, something of that nature, so that you have a reference for it and then are able to monitor it. So in women, we do self-breast exams on a monthly basis. For our pets, we should still also be examining them on a regular basis, whether that's weekly or monthly, that we feel them for these lumps and bumps and we keep track of them, like a little journal, knowing where these lumps and bumps are, what was their size, have they changed? And of course, like we talked about earlier, if there are things that are changing, growing, look scary, then those are the ones we're going to want to get checked out with our vet sooner than later. This dog, thankfully, does not have a bunch of tumors. This dog just got into the box of cereal and has Cocoa Puffs all over him. But unfortunately, I have seen some dogs with this many tumors. And that is what I can recommend to everybody, to try to hopefully not get to that stage, to get these things, to catch these things early and make sure we get them tested and not wait until they are actually a problem, and to where we don't have the options that we would like to have. So with that, I will kick it back to Michelle and whatever questions have been asked during all of this.
Wow, thank you so much, Dr. Kennedy. That was an amazing presentation. We had many really great comments, and just a nice compliment that you're illuminating cancer across species in such a clear way. This is the most succinct explanation of cancer I've ever seen. You're doing a great service to pets and their owners, and very true. Okay. So thank you again for doing this. Okay, so we do have a lot of great questions. We'll try to get to as many as we can. We have one question about a mast cell tumor that the vet did not think it was a mast cell tumor, and then the dog scratched it and it scabbed over. Basically, if you see this, should they be tested? At what point, or especially with mast cell tumors, I know that if it's 1 grade or if it come back again, maybe you don't need to have it removed. I don't know. I guess it's just when to test. I know you're going to monitor it yourself, but what do you recommend in that?
Right. And absolutely monitor yourself, but also absolutely bring it up to your vet so that it can be tested. And these are things that's why we test them, is so that we can identify, yes, this is a mast cell tumor. It's not just a cyst that ruptured open and got infected and it'll heal and it should be fine on its own. It is actually something more scary. It is a true cancer and a mast cell tumor. And so we need to go ahead and remove it. So, I would say anytime you're having a lump or a bump that is getting scratched at or is becoming open and ulcerated, yes, those can be benign things like cysts, but they can also be more scary like a mast cell tumor. And unfortunately, there's no way of knowing that just based on how it feels or how it looks. We have to actually get a sample of the cells, and actually look at those underneath the microscope. So doing those needle aspirates to get those cells out, it's something that usually doesn't even require any type of sedation or anesthesia. It's just a quick poke, just like a vaccine. And so, that would be the time where I would definitely recommend that type of testing, because mast cell tumors can be the great pretenders. They can look like anything.
Yeah. Okay, great. Are there breeds that are more prone to malignant tumors? That's one question.
There are. And so, unfortunately, golden retrievers, as much as they have a great heart and a great soul, they also are cancer factories. And so that for that reason, we've actually, used them for some of the longer term studies of cancer. Beyond that, it does depend a little bit on what exact type of tumors we're talking about. For example, for melanomas, the skin melanomas at least, Rottweilers, Doberman Pinschers, those types of black and tan breeds, in addition to Schnauzers, are going to be more predisposed to getting them. Boxers and Bostons and Labradors are more common for the mast cell tumors. So each breed is going to have certain ones that they're more likely to get, or each type of tumor is going to have certain breeds it's more likely to show up in. So beyond saying, I have this type of dog, it might be this type of tumor, I think it's knowing what to look for in the individual lump or bump to say, okay, this is scary, we need to get it tested.
And do you recommend kind of feeling your dog, doing right every so often, or just, or your cat, cat or dog?
Yeah, either one. And ferrets, rats, whatever type of pet you happen to have, everybody. We sit and kind of pet our pets all the time, and it's just a matter of making that into more of a conscious effort, where we're actually feeling them for lumps and bumps, feeling them down on their chest and their armpits, on their belly, those areas that we may not normally think to feel. Also, if your pet's getting groomed or bathed on a regular basis, Make sure you talk to your groomer. They a lot of times will feel things or see things that we may not notice on the day-to-day basis. And that's oftentimes the best time to be able to feel things too, is right after they've gotten a haircut. Their hair is a little shorter, maybe it's a little easier to feel things, especially on some of our longer haired breeds that are, it's 4 inches of hair before you actually get down to the skin. So, definitely take advantage of those. I would say at very least on a monthly basis, you should be feeling for those lumps and bumps. But really anytime that they're laying with you and you're petting them, that's an opportunity to just, run your hands over them.
Great. And while you're mentioning the fur, we did have a question about, should you not shave down your dog's fur? Could that be risk of skin cancer?
From the standpoint of increasing UV exposure, sure. So if you have a dog that is actually an outdoor dog and doesn't have a lot of shelter, they like spending a lot of time in the sun and laying on their belly and those types of things, then that might be a reason to keep their hair a little bit longer. Doesn't mean you can't trim it, just maybe don't shave it all the way down to the skin. Or the alternative is you can still shave them, and just when they're outside, they wear a sweater or a coat of some kind. They even make little doggles, sunglasses for dogs that, they don't always like them, but they do. They look very cute and they do a great job of blocking the sun.
Right. Okay. How do you detect mast cell tumors in cats when they are internal?
So usually a lot of times it is a similar idea where they cause a mass that we can try, if the mass is big enough, we can try to stick a needle into it to get a sample of those cells out. That's not always successful. And so sometimes we do have to either take surgical biopsies or use a scope to take biopsies, depending on where exactly that lump or bump is. But usually those pets are not feeling well, and that's why they're coming to the hospital to start with.
Okay.
The nice thing about lumps and bumps on the skin is a lot of times they're actually feeling just fine. And that's why we have a little more time to figure out what's going on.
And I know the internal lumps and bumps, that's a whole nother lecture. Hopefully you'll come back for that one.
We can do 10 more lectures on that.
Yeah. Okay. If you have a pet prone to allergies, would putting them on a regular antihistamine help prevent mast cell overreactions and tumors?
So the short answer is we don't think so. That's something that has been tried and has been investigated a little bit, and it doesn't seem to prevent mast cells from forming. That being said, it does make our pets feel better when they're having that itchy skin and all of the flare-ups and everything. So I do think it's still worth treating them for their allergies and just so that they can make them feel better. It just doesn't necessarily seem to stop them from forming mast cell tumors if they're going to.
Okay. We had also a question about genetic testing. Like we have in humans, do we have that for pets as well?
Less so. We have pretty good genetic testing for being able to try and guess what breed some of our pets are, because some of them are Heinz 57s and we don't know what breed they are. We also have some pretty good genetic testing for the tumors themselves once the tumor has actually been removed, to try to know and predict how aggressive they're going to behave, or if certain drugs are going to work better than other drugs. Right now, we do not have a lot of the screening genetic tests that are in humans, where we can actually look for those predispositions to forming certain types of cancers. That's something that's being researched, and hopefully we're going to have in the future.
Okay, great. We had a question also about lipomas. How a malignant tumor versus a lipoma, do they feel different?
Usually, yes. So a lipoma is going to be soft and squishy. I know my love handles are getting a little big this time of year, and so it should feel like that soft and squishy. If it feels firm, then it's probably not a lipoma. It's probably not a fatty tumor. A fatty tumor should feel like fat. If it doesn't feel that way, then it's something worth getting checked out.
Okay, and do lipomas, they change into, could they become malignant? question mark.
There are malignant fatty tumors that are called liposarcomas. As far as we can tell, that is not a transformation that happens very often. So most of our pets, when they have lipomas, they're going to stay as benign tumors for most of their life, and they're just going to slowly grow. And so usually we only need to address them if they're in an area where it's going to be difficult for them if they continue to grow, if they're in their armpit and they're having trouble walking, those types of things.
Okay, great. We have a question about if there are ingredients in food or toys or bowls that could lead to these tumors.
I mean, similar to what, things that are carcinogens for us, they're also carcinogens for our pets. So, there's a lot of the plastics that we use now are BPA free. That's because BPA was concerning in a lot of the trials that were done. I think it's more that idea of clean eating and avoiding a lot of those same things that you and I are supposed to avoid, to try and reduce the exposure as much as possible.
Great. One question, a couple questions actually about the injections. One woman saying her cat gets frequent Adequan injections for her arthritis pain. She gives them to her on the outside of her thigh. Adequan relieves her pain. She's worried about that causing fibrosarcoma.
So yes, that's great that you're giving it outside on the thigh and further down on the leg. That's exactly perfect. That's where we want those types of injections to be given. We do know that any injection can cause this type of development of cancer. Thankfully, it's usually over a period of several years. So it's usually 5 to 10 years later that they're actually developing into cancers. It's not usually that something that happens just in a few months. So probably it's not going to be something that ever causes your cat a problem anyways. It's a 1 in 10,000 kind of thing. It sounds like the Adequan is more important than any risk might be from the injection.
Okay, great. But it is the injection versus not the ingredients necessarily in the vaccine that is the risk, right? So
yeah. Originally it was more the actual vaccine. The type of vaccine we were using was a little bit more irritating just so that it would work and be more effective. Since we realized that that was making this problem worse, we actually switched the type of vaccines that we give in cats so that they are a little bit safer and that this is more likely to occur to start with.
Great. And on that note, we have, given the danger of fibrosarcomas arising from injection, what do you recommend for cat vaccinations? Should rabies, FRCP, so should some,
yeah. So in terms of should you still vaccinate your cat or dog? Absolutely. This is primarily a cat problem. And like I said, it's a 1 in 10,000, 1 in 50,000 type of occurrence. Whereas those other diseases that we're vaccinating for are much more common in their occurrence. So it is important to still fully vaccinate your pets. If you have an older pet and you're worried about it, certainly that's a conversation that you can have with your veterinarian. We do sometimes have ways that we can check to make sure that your cat is still maintaining their immunity rather than having to automatically give the booster. So that could be an option. And probably most importantly is just the location that the vaccine is given, farther down on the leg or out on the tail, so that if we do end up in an unfortunate circumstance where it does develop into a tumor, we have better options at treatment.
Okay, great. All right, well, this has been really wonderful. There's so much great information, and everyone, as I said, it will be posted tomorrow. Thank you so much, Dr. Kennedy, for your time. We are so grateful and grateful for all of the wonderful work that you do. And thank you to everyone so much for joining us. On behalf of my colleague, Kimberly Young, and all of us at Animal Medical Center, we want to wish you a very happy and safe holiday season. And thank you again for trusting us with the care of your pets.